Anal cancer. What to know? Anal cancer occurs in the anus, which is at end of the gastrointestinal tract. It is different from and less common than colorectal cancer, which is cancer of the colon or rectum. Anal cancer is rare, but the number of new cases is rising. Various factors may increase the risk of anal cancer, but infection with two types of human papilloma virus or HPV appears to underlie 91% of cases. Anal cancer is rare before 35 years of age. The average age of diagnosis is when a person is in their early 60s. Around 1 in 500 people will develop anal cancer at some time. At first, anal cancer may resemble hemorrhoids. Anyone who notices changes in the anal area should see a doctor. Often they do not have cancer. If they do, an early diagnosis is more likely to lead to a positive outcome. Symptoms. Common symptoms of anal cancer include bleeding from the rectum, itching around the rectum, pain or a feeling of fullness around the anus, lumps that may resemble hemorrhoids, changes in bowel movements, narrow stools, a discharge from the anus, swollen lymph nodes in the groin or anal area. Some of these symptoms can also be the results of hemorrhoids, anal warts, or anal tearing. However, a person should see a doctor if these changes occur to rule out cancer. Causes. Anal cancer develops when cells grow uncontrollably and form a tumor. Two types of cancer can form in the anus, depending on where the cancer starts. Squamous cell cancer. The anal canal connects the rectum to the outside of the body. Squamous cells line the canal. These flat cells look like fish scales under the microscope. Most anal cancers are squamous cell carcinomas because they develop from squamous cells. Adenocarcinoma. The point where the anal canal meets the rectum is called the transitional zone. It has squamous cells and glandular cells. Glandular cells produce mucus, which helps the stool pass through the anus smoothly. Adenocarcinoma can also develop from the glandular cells in the anus. Around 3 to 9% of anal cancers are of this type. Risk factors. The risk factors for anal cancer include HPV. There is growing evidence that some types of HPV increase the risk of various cancers. Researchers have linked the presence of HPV-16 to various cancers, including cervical cancer and some head and neck cancers. Other cancers. People who have had another HPV-linked cancer seem to have a higher risk of anal cancer. For females, this includes vaginal or cervical cancer or a history of precancerous cells in the cervix. Males who have had penile cancer have a higher risk also. HIV. People with HIV have a higher risk of developing anal cancer than people without the virus. Reduced immunity. People with a suppressed immune system have a higher risk. The immune system can be weaker in people with AIDS and those who take medications following a transplant. Sexual activity. Having multiple sex partners can increase the risk, as this increases the chance of exposure to HPV. Sex. Anal cancer is more common in females than in males. However, among African Americans, it is more common among males up to the age of 60 years, after which it is more likely to affect females. Age. As people get older, their chances of developing anal cancer increase. Smoking. Smokers have a significantly higher risk of several cancers, including anal cancer. Quitting may lower the risk. Treatment. Treatment for anal cancer will be different for each person. Factors that affect the options for treatment include the size of the tumor, the cancer grade, as high-grade cancers can be more aggressive, whether cancer has spread, the individual's age and overall health. Surgery, chemotherapy, and radiation therapy are the main treatment options. Prevention. To reduce the risk of anal cancer, a person can have the HPV vaccination before they become sexually active. Use condoms they having sex. Avoid or quit smoking. People should seek medical advice for any changes that affect the anus, even if this give no suggestion of cancer. An individual can also ask a doctor about screening if they have a high risk, such as a HPV infection. Anal cancer is a relatively rare cancer with close links to the HPV. Having the HPV vaccination and seeing the doctor about any changes in the anal area can help reduce the risk of anal cancer and its complications. People with a higher risk should consider asking their doctor about screening.